Today, we're going to dive into a topic that many people don't realize is part of their gout story: gout in the knee. When we think of gout, most of us immediately picture the big toe, red, swollen, throbbing. But that's only part of the story. Your knee can get hit by gout too, and when it does, it can be confusing, painful, and frustrating. So first, what exactly is gout in the knee? Gout is a form of inflammatory arthritis caused by excess uric acid in the body. When uric acid builds up, it can form tiny sharp crystals that accumulate in joints and soft tissue. While the big toe is the most common place, the knee is one of the major joints that can also be affected. When uric acid crystals get into or around the knee joint, they irritate the tissues. That triggers inflammation, swelling, redness, pain, all the things that make you limp, wince when you bend your knee, or dread walking. In many cases, people don't think gout when their knee flares up. They assume it's an injury, wear and tear, arthritis, or simply aging. But the truth is that untreated gout in other joints can move up and affect the knee. Next, let's talk about how knee gout feels. If you have gout in your knee, here are common signs. Sudden and intense pain in your knee joint, often starting at night. Swelling in and around the knee, sometimes the whole knee becomes puffy. The skin over your knee feels warm to the touch, could even be red or shiny. Tenderness, you might flinch if someone lightly touches or presses your knee. Stiffness and restricted movement, you may find it hard to bend the knee or bear weight. Sometimes after the flare subsides, the skin can become itchy, flaky, or peel. One thing to note, a knee gout flare can last days to weeks. It's not just a short pain. And if you don't treat it, future flares often become more frequent and more severe. Now you might ask, why the knee? Why do crystals show up there, and why does it happen? There are several reasons. 1. High uric acid levels, hyperuricemia. Your body makes uric acid when it breaks down purines found in many foods. Your kidneys are supposed to filter and eliminate the extra uric acid. If either you produce too much or your kidneys can't clear enough, you end up with higher blood uric acid levels. When uric acid is too high, crystals form and settle in joints. 2. Joint temperature and blood flow. Joints like the knee can have conditions where temperature is slightly lower, or movement and circulation make them prone to crystal deposition. Also, joints already weakened by osteoarthritis or prior injury may be more vulnerable. Some studies show that knee gout is more likely in a knee that already has wear and tear. 3. Risk factors and triggers. If you have a family history of gout, if you are overweight, if you drink alcohol, if you eat lots of purine-rich foods, or if you have kidney issues, your risk goes up. Additionally, certain medications, like diuretics, and conditions that impair kidney function can make things worse. So the knee becomes part of the story because the same mechanisms that cause gout in the toe can also work in the knee, especially when the knee is already under stress or has other joint issues. If you suspect your knee pain is due to gout, here's what you should know about diagnosis. A healthcare provider will usually ask about your symptoms, pain, swelling onset, and examine your knee joint. Check your blood uric acid levels, though note, having a normal uric acid level doesn't always rule out gout. Use imaging tests, X-ray, ultrasound, sometimes dual-energy CT scans to detect crystals or joint damage. In some cases, a joint fluid test. The doctor draws a little fluid from the knee joint and looks at it under a microscope to see if uric acid crystals are there. It's important to get the right diagnosis because knee pain can look like many other conditions: osteoarthritis, bursitis, infection, ligament injury. Gout requires a different treatment approach. Once you have a diagnosis or strong suspicion of gout in the knee, you can move on to treatment and how to protect your knee in future. Acute flare treatment. Your doctor might prescribe NSAIDs, non-steroidal anti-inflammatory drugs, like ibuprofen or naproxen to reduce inflammation and pain. Colchicine is another medicine that's used to treat gout attacks. Corticosteroids, oral or injected, can be used when NSAIDs or colchicine are not suitable. During a flare, you may also want to rest the knee, elevate it above heart level, Apply ice or a cold compress, avoid putting heavy weight on it, and stay well hydrated. Long-term management. The real key? Controlling your uric acid levels over time. That helps prevent future flares and joint damage. Your doctor may prescribe urate-lowering medications such as allopurinol or febuxostat, or drugs that help your kidneys remove uric acid. Lifestyle changes matter. Drink plenty of water so your kidneys can flush uric acid. Avoid or reduce alcohol, especially beer, sugary drinks, red meat, shellfish, organ meats. Maintain a healthy weight. Excess weight puts more stress on your knees and raises uric acid. Move the joint gently. Light exercise helps circulation and joint health. Why early treatment matters. If gout in the knee is left untreated, the inflammation and uric acid crystals can stick around, damage the joint cartilage, bone, and surrounding tissue. Over time, this may increase your risk of needing more extensive interventions like knee replacement surgery. Living with gout in the knee is not easy, but you can live better with it. Here are some real-world tips that have helped me and many others. 1. Listen to your body. If your knee wakes you at night or you notice swelling, heat, or even just stiffness, don't ignore it. The sooner you intervene, the easier it is to reduce the damage. 2. Track your triggers. What did you eat? Did you drink alcohol? Did you go a long time without enough water? Did you stress your knee or injure it? Knowing your triggers helps you avoid the next flare. 3. Protect the joint. Don't overload your knee when it's painful. Give it rest. Use ice. Elevate it. But don't become completely inactive either. Mild movement helps keep fluid flowing and prevents stiffness. 4. Don't skip medications. If your doctor prescribes medicine to lower uric acid or treat a flare, follow through. Gout is a chronic condition, and skipping meds often leads to repeat flares. 5. Make lifestyle changes that last. Diet, hydration, weight, alcohol use. These matter. But it's not about perfection. It's about consistent small steps. 6. Watch joint health overall. Since the knee is already a big weight-bearing joint, any arthritis, prior injury, or excess weight will make things worse. So treat the knee as valuable. Protect it, strengthen it. 7. Stay hopeful. Every flare you prevent is a win. Every day your uric acid stays lower is a win. One step at a time. To wrap up, gout in the knee may not be the most talked about form of gout, but it's absolutely real, and it's absolutely important. If you notice sudden knee pain, swelling, redness, warmth, especially if you've had gout in the past, don't just assume it's arthritis or wear and tear. Ask the question, could this be gout? And if you're managing gout already, don't ignore your knee. Take steps today. Drink more water, watch your diet, move gently, protect your knee, and work with your doctor to keep uric acid in check. The knee is a major joint, and you want it working for you for years to come.